So, Apna Merit mission, as we see it, is to improve access to quality healthcare in Pakistan, utilizing Pakistani diaspora through medical education, research, information, and technology transfer. There are aspects that are not covered here, which are covered by other committees. So there's Social Welfare Development Committee, there is medical clinics and mobile health committees, and so on and so forth. So there are various other committees doing other aspects of that part, but this is what we have focused on as a mandate for Apna Merit. And this is a big challenge. Most of you are already aware of this data. So this is the data I use for people who don't know the background or healthcare challenges. So I'm going to skip that in interest of time. But when I see these dismal numbers, when I started going back in Pakistan, the question was that why can't we train more neurologists from Pakistan? And why can't we here in APPNA cannot train more neurologists from Pakistan? And the most of the requests that I used to get was that, okay, take this guy with you to University of Nebraska, train him and send him back. And I used to tell them, even if I take one a year, it will take me 10 years to train 10. And how good, would that be for movement disorders in Pakistan, or stroke in Pakistan, or things like that? How will that fill the gaps that we're trying to fill? The traditional method of teaching that we have been participating in the past is that we'll go there, we'll give lectures, we'll do skill workshop. I did a lot of workshops. I used to do 3 or 4 workshops every year on various parts of neurology. We did stroke workshops, stroke lectures, but that was not making a sustainable impact. We didn't have any curriculum around it. It was more of just standing there and giving one presentation at a time. So what we started looking at was this idea that online education has really taken hold. People are becoming comfortable, and you can actually teach them through various online tools and methods. And even the smartest guy in the world right now, presumably Elon Musk, is teaching his kids through YouTube and Reddit online resources, and not textbooks or paper information. So, if we really dissect what learning is and try to divide it into various components, most of them are achievable through online interactions by giving them more than just watching a lecture. So yes, watching a lecture may not be enough to create a lasting change, a culture change, or a habit change, but many things more can be done online instead of just watching a lecture. And that's what when we package it together, we call a course. So, and then we remind ourselves every day that do not let what you cannot do interfere with what you can do. So we want to focus on what we can do instead of always just talking about what we cannot do. So these are the 3 thoughts that we came up with as our objectives last year when we were starting to plan for 5 years. We wanted to develop outcome-focused online programs using modern methodologies to fill in the knowledge gaps and skills gap in Pakistan in certain niche areas. So for example, point-of-care ultrasound, it's something new. A physician is trained to examine a patient and maybe even trained to use a regular ultrasound, but what about this new point-of-care ultrasound, which is handheld device? Similarly, botulinum toxin injections, the Botox injections that I do, various such skills have evolved in the last 10 years that does not exist in Pakistan in a comprehensive way, widespread. We wanted to enhance the awareness and collaboration between Pakistani diaspora and stakeholders in Pakistan. That's another problem we saw, that there was a lot of enthusiasm and interest in Pakistani diaspora, but they did not know where to go and who to talk to and how to connect. And then we wanted to empower the Pakistani diaspora to design programs and deliver a change by providing them that infrastructure. So they wanted to do something, but they didn't have time to sit down and develop everything from the scratch. So how we're doing it, we have been using a 10 steps methodology. We have been establishing subcommittees, which are program focused. We have been developing a decentralized organization structure so committees can feel independent and do whatever they want to do and not slow down by a centralized control. And we have established this virtual office for program coordination. We have been training program coordinator and gathering all the resources, online learning management system, and so on and so forth to be able to implement that. Then we have been strengthening established relationships with institutions in Pakistan, establishing relationships with other alumni association and Pakistani diaspora association in other countries. So we have been working with APPNA, with AP, with APSUC, and so on and so forth. And we have been growing this program portfolio to go to larger audiences. That's another thing that we wanted to do, is to think big. Training 5 people, 10 people is not really impactful. We want to train and educate thousands of people and really think in a large global national impact. Introducing novel concepts and innovations to solve those problems that seem very challenging, explore areas of strength in Pakistan to take advantage, reduce the friction and barrier to entry for people, both sides, here, alumni, and from Pakistan, and align programs with all stakeholders to avoid duplication. We have been doing many different things. Quick snapshot before I invite different program committee chairs to tell them what they've been doing. We have a growing YouTube channel that has been getting really busy with a lot of useful information there. We have online courses portfolio. We have our own learning management system, APPNA Academy, which currently has 9 courses hosted and growing. And we have a partnership with University of Nebraska Medical Center's learning management system, Canvas Catalog, and we have another 13 courses published, and another 6 that we're currently working on with certification from University of Nebraska for those courses that is online. And we have our students do assignments, interact, do group learning, create a community of learning from wherever they are and whatever background they have. We involve them in discussions, in online discussions to learn and with each other. And one such example is our program on family medicine specialty rotation that you'll hear more about from Family Practice Committee Chair. The feedbacks have been excellent. And I think people are really making a change in their clinical practice wherever they are practicing.